It's more of, as Kyle had mentioned, we've been using our probationary period.
Make sure folks are the right fit.
Yes, and we really adhere to our behavioral standards. So if we have individuals that cannot seem to adhere to it, we just move on. We're trying to build a really good culture with our teams. And so that's pretty much it.
Usually it just results in, we need operator ones kind of always.
Yeah.
Our ones end up
Or your
becoming our
entry.
twos and our threes, but it's that usually we're hiring at that entry level. And then the people that are doing great.
We are getting applications. It's just,
Yes, facts.
you're trying to make sure that they're gonna work out well, but have good customer service skills, all those things.
All those things, yes. And so what I really wanted to do, I have a few pictures here of the team, but I think one of the collateral benefits of this full going public, I can tell you, when we interview staffing, we've got a lot of talent that came in. We get some really good resumes that come across. And people are excited for these jobs. They want that stability, they want those benefits. And they wanna, be invested in their job, and we're getting quite the buy-in from the teams. They feel like they own the facilities. And they wanna take care of them, and it's really it's a pretty neat turnaround from when the contractor had ran it to now. But this is just, here's a couple teams in the morning meetings. I asked them to snap some pictures. It's obviously not the whole crew because we work 7 days a week, so we rotate around, but go to the next slide, Ron. This is our new compactor and the controls there. That's CJ, one of our leads at the Valley. He's taken upon it himself to be the expert operator of our compactor, but he's learning a lot about it. But I wanted you to see what it looked like. And then one more picture. There's our programs manager on the left side. I'm not sure what he's doing, but we got a picture of him, and then our drivers with a thumbs up. But yeah, collateral benefit, definitely just the staffing. And it's been a pleasure to interview them and hire them and see like how excited they get about what they're doing and the efficiencies that they. So, Lindsay, do you have anything to add?
One of the things that's been really fun to watch is the culture being built, and there's this almost competitive nature about how efficient we can be. So when we did our disposal and transport contracts, it was based on a certain container weight, which means how much garbage can fit in a container, and they have exceeded what we thought would be possible. And so at the sites, they're kind of competing like, oh, well, my container got this much. And so there's, some really good-hearted competition between the staff to say, yeah, we know how to do this well, and we want to prove that. So seeing that come through and competition, and then also savings to our ratepayers has been really gratifying to watch.
And that's been really key to our business case here, because we thought we could probably exceed what the contractor was getting in container weights by about 5%, and we're closer to 10%. And the new transport contract that we negotiated is per haul, not per ton. So that is just all direct savings to the community.
Yep. So again, I want you to know this has not been an easy lift. The staff has worked really hard.
Someone's laptops on.
If you did hear that, then up your medication.
You're on hold.
So what's the average turnaround, to haul to the, what's Davenport?
It's down by Washington. Thank you. I always
Washington.
remember the letter, but I didn't remember the name. So it's about 111 miles one way. So
So a 4-hour turnaround.
yeah.
By the time you dump and.
The trucking company's been doing a great job, so they're working out really well. But yes, again, it was not an easy lift. This was a tough job. The last year just I don't even know what happened. What hit us.
Hey Deb, what do you want to do in your last year before you retire?
Take over a whole new line of business.
We certainly didn't coast. We appreciate that.
It's been very rewarding and, you know, I'm really proud of what our team has accomplished. And I just can't thank you enough for the support. So, felt good. So thank you. That's all I have.
And you always have a smile on your face. Deb. Thank you.
I enjoy my job. I really have enjoyed being a public servant. It's been very, very rewarding and motivating. for me. So, 31 years of it.
Now you're gonna open up your own private consulting service.
We'd hire her in an instant.
It's actually, no, I'm gonna go play. That's my plan.
Good for you.
Any other questions for Deb? Last shots in before while you have a chance?
You've done a great
Yeah.
job. Thank you.
Thank you for everything.
Thank you. I appreciate it very much. I'm gonna.
Thank you, Deb.
Thank you.
There he is.
I'm going to miss all of you, so, but I'm sure I'll do okay. All right, thank you.
Thank you. All right, next up on our agenda, we have Doug Chase. Briefing about amending Beacon Hill Public Phase 2 interlocal agreement.
Good.
Doug.
Okay, I think I have a single slideshow. Which really is just a refresher of the project. You may recall. We as mentioned, an agreement with the city of Spokane. And going back to the original phase 1, the county took lead in the grants involved with acquiring some of the property, and in this. On the enhancement side, the city has taken lead. We, here, the amendment really is designed to take advantage of some capacity with our project manager, Julia Cole. And will help with some budget savings here in 2025, and some of that may carry over into 2026. Every little bit adds up, and so specifically, the amendment to the agreement would allow for up to $12,000. We're estimating in her time to be reimbursed, and she would assist in project management. We're anticipating this phase of the project is likely to start in August of this year. There's been a slight delay due to some cultural resource study and additional information that the National Park Service, which is the grant supplier through RCO, has asked for. They're wrapping that up, and again, if you approve, this would allow for a $12,000 reimbursement, which helps reduce the amount of extra help that we've had to scale back on this calendar year in meeting and working within our budget allotment. I'm happy to answer any questions. Okay.
I'm glad it's moving
Good.
forward.
Yeah, it's been a really good relationship, and we're pleased to be able to take advantage of this opportunity and be as efficient as we can.
Thank you,
Thank you
Doug.
very much. Appreciate your time.
All right, next up, Jamie Hayes to talk about award acceptance, DOT Safe Routes to School.
Good morning. And once again, I'm Jamie Hayes. I'm the Senior Project Manager for the Public Works Department here at Spokane County. And I want to let you know about an award we just received through WashDOT. It's through the Safe Routes to School and Pedestrian Bike Program. This opportunity is up for funding every 2 years. So last year we planned and scoped a project or a couple of projects for this program, and we were awarded just short of $1 million for Creekside Elementary, $940,000 with zero match involved. Next slide, please. This is basically a safety program where we will fill in sidewalk gap, include ADA ramps, 20 miles per hour when flashing beacons, and some illumination and rectangular rapid flashing beacons in 2 locations. Next Slide. This is the project area. In Lime is the 20-mile-per-hour zones. It's a little hard to see, but at the top at Farwell, we have, that's where one RFB will be installed. What we found is that the ADT is just short of 10,000 cars per day there. And that the average speed is about 47 miles an hour in a 35-mile-per-hour zone, warranty, safer crossing improvements. And then down at Market at Fourth, we have a similar situation where the ADT, the average daily traffic is over 10,000, quite a busy area with some higher speeds. To the southwest of Creekside Elementary School in that gray line, that's a little difficult to see. That's where the sidewalk gap will be filled in, adjacent to existing properties. ADA ramps will go in there too. And then you can see that that will lead to the new development where I'm sure there'll be an influx of kids trying to attend Creekside Elementary School or trying to get to the sports field there. Go ahead for the next slide. So you can see the project area. You can see this is in North Spokane, kind of just south of US 2 and east of the new NSC. And then next slide. This project should be constructed in 2027. And with that, do you have any questions about this award?
Really like the no match.
Yeah.
Yeah.
It's great. It's perfect.
Those are good.
Will there be another round coming up?
In 2026, correct?
Okay.
Yeah.
Yeah, I had a call with the city, one of your engineers and the city and Councilman Cathcart, because there's some potential opportunities up in the Arlington Elementary area between the kind of where the city and county
Yeah.
meet and so there was a brief discussion about maybe in 26. That would be a good opportunity to go out for some safe routes to school in that area around Francis and Crestline.
Absolutely. We're scoping it now, and planning out the project for potentially to apply.
Excellent.
And these are great projects. We haven't been awarded very many of them in the past, and we seem to be getting them rolling in now. So pretty excited about that. Noted, and I'll make sure that's on the project list.
Yes, yes, you bet. I think we've probably worked on that for many, many years and
I
maybe through other sources, and this seems like a source that would be likely, especially
Yes.
since you see them coming in more frequently.
yeah, fingers crossed they keep rolling in. So
Yeah.
All right.
All right.
Thank you very much. Have a great
Thank
day.
you. Okay, next up is Tori. All right. Tori, you got the next two agenda items on here, so take it away.
Oh, yeah. Just go all three of them. Morning, thank you. I am briefing you this morning on a couple of the grants that we received. One is our alternatives to detention. Might be the third or fourth year on this through DCYF. And what this funds is a bed for us at St. Margaret shelters for our kids that are at risk or are victims of child sex trafficking. So they can be housed there at St. Margaret's and get the wraparound services. We partner with Lutheran Community Services for their victim advocacy. Sometimes these youth can end up in detention because it's the safest place, but they're victims. And so that's what we received this grant for, $50,000 a year. That covers the services, doesn't cover our staff or anything. It's just the services for the kids. Any questions on that one? The next one is our evidence-based expansion grant. It's money from the state through DCYF for our evidence-based programs. Obviously, big push in Washington and juvenile justice. And our block grant that we receive, actually, that formula includes youth that participate in these programs. So it's our coordination of services for our low-risk kids. That also includes family, functional family therapy for the kids and the family. And EET is education and employment training for kids, gets them connected, gets them some job skills experience, interview experience, etc. And again, that grant is, we don't have the dollar amounts of these, we're kind of under that bridge clause in here, been around 320, at least the last 2 years, was 320,000 a year. Most likely going to be about the same.
How much of that 300, approximately 330,000 goes to staffing? Staff costs.
We have one full-time in our coordination of services. 3. Full-time and 145,000 to the contract for the therapy.
For the there, okay, but they're the folks who have the evidence-based training.
Correct, but our staff do as well. Our staff are involved in the coordination of services. They run that, but that includes the community coming in, and it's kind of for our lowest kids. We're gonna help you help yourself, because they're not always with us, so it's connected to community resources. And then the EET, our staff run in partnership with the community. For example, the Parks Department, they will take our kids out. Associated General Contractors will take a group of kids and show them heavy equipment, what's out there in the construction. And a partnership with St. Luke's. So, and that will fund some of those as well. Anything else on those?
Nope, doesn't look like.
All right, well, I'm gonna turn it over to the business manager, Nicolene.
Hi, so I'm here to brief you on the 3 single case agreements that we've got with CHWP, Molina, and with WellPoint. This is a part of the HCA Reentry Initiative grant that we're participating in, for getting juvenile ramped up to be able to do these reentry services. And so we are in the process of getting contracts with all of these managed care organizations put into place. But in order to do billing, now that we have officially gone live with HCA, we need to have these single case agreements signed so that we can have our business manager or nurse manager start to do billing for the services that Juvenile is offering and bill the managed care organizations. So that's kind of what these are. Any questions on those? Okay, great.
Thank you.
Thank you.
Thank you.
Hey, and then is Lynn here?
Be ahead.
Only about 10 minutes. It's about 10 minutes in, but I know Gina stepped out, so she may be going out to bring Lynn in. Any miscellaneous items while we wait for our next presenter? Go for it.
So there is the housing forum tomorrow morning, and I'm assuming that we're all going to that, but we are not
going.
meeting tomorrow morning, right?
Correct.
Okay.
Yep.
Just want to confirm, so.
Yep. It looked like we got a calendar invite for 11 to noon and then it was canceled. So yeah, no, I don't think we're meeting tomorrow morning at all. So we can all go to the housing forum.
Okay, and it starts at 10,
I think it's 9.
is it 9?
I thought
9:30,
9 to 10:30.
9 to 10:30, okay.
9 to
9 o'clock.
10:30. And where at?
Are you sure you're going?
Question.
Well, I RSVP'd for it, and so,
Convention Center.
okay.
Yeah.
But things change, been out of town for a week, I don't know what happened.
It's at the Convention Center.
Commissioners,
Oh, yeah, if you could find what room it's in, Mary, put that, because I can never figure out if it's on the one side or the other side.
confirming, yes, no meeting tomorrow. There was an initial hold from 11 to noon in case we needed some time, but we were able to get all the agendas on today's calendar or this morning's briefing.
All right, thank you, Scott. I actually don't see the room listed on the website.
Crazy.
It just says Convention Center.
I'd be happy to check in and email everybody.
Okay.
Just saves you time going back and forth.
Just follow the crowd.
Yeah. Say that, yeah.
True, true.
Where do you park? Do you park at the
Yeah.
Davenport, take the Sky Bridge across, or do you park in the parking garage by the boat? No, I'll walk out.
You may have to get extra steps.
Walk down the opposite on the road.
Park where all the other cars are.
Well, is there any media or
Yeah, anything else going on?
donations, Martha Lou?
Jan? Are we like waiting on Lynn?
Nicolay,
Oh, no, she already presented.
oh, she did.
So yeah, we're waiting on Lynn
Lynn.
from AltQ.
Okay, can we pick Justin while we're reading them?
Sure, but take it away, Martha Lou.
Okay, well, it kind of took me by surprise. All right, so we had, the usual news releases go out last week, you know, about the 4th of July closures, weekly road construction and maintenance update. We also had a news release for burn restrictions in county parks. And then the Liberty Lake ORV Park is closed right now because of increased fire risk. Scraps on Thursday seized a number of animals. We did not announce that. We need to be considerate of the fact that 2 minor children were also on the premises and are in the custody of CPS due to unsanitary and unsafe conditions. But it was an illegal kennel, dog breeder, grooming, that sort of thing. So I'm working with Jesse on an announcement about that. Now, Commissioner Kearns, you had asked about a proclamation.
Yeah.
So I worked on that. The draft has been approved by prosecuting attorney Haskell. And it would declare, it would be presented on Tuesday, the 15th. It would proclaim July 17th as Lawrence H. Haskell Appreciation Day, which is the day before he retires. Does this have your approval?
I'm good with it.
I'm good.
Do you want to share the proclamation? I mean, that's fine.
Yes, I have it right here.
Okay.
I haven't seen it yet either.
It's
I just asked that we
basically,
do an honoring Larry for his years of service.
it's basically reviewing his career and that this is an appreciation for decades of public service throughout his life.
Were you concerned it might have said something inappropriate?
That sounds good. I don't know. I didn't know we were doing it, so. Just wanted to look at it. Looks good.
You good with it?
Yeah.
Okay, well, we'll proceed with that next week. And I'll get it to Gina.
I'm good too, for the record.
Thank you very much, Commissioner Jordan. Today we have the taping for Spokane County Spotlight. Commissioner Waldriff is the hostess.
Talking about the APA, the Aquifer Protection Area.
Who are you interviewing for?
Ben Bradeboat is gonna be on there and someone from Spokane Riverkeeper,
Caitlin Scott.
which we need to confirm if she likes to go by Caitlin or Katie, just for the official, you know, when you have, when KSPS puts the information out, just we should check on that.
Okay. All right,
So yeah, we're gonna
thank
talk
you.
about the history of the APA, what the Aquifer Protection Area funding can cover, some of the education activities that have occurred, the water quality monitoring work, and highlighting that now it's a renewal with adding the city of Spokane. So just kind of covering the facts,
Purely information.
purely information.
So, and unless Pat has anything to add, that's it for the communications office.
Nope, that's great. Thanks.
Okay, thank you very much.
All right, thank you.
All right, Justin, you're up. Awesome.
Morning, commissioners. Morning. We have a few items to cover, and some requests to the board, so jump right into it. Two of the items there from DSHS were late additions from our briefing 2 weeks ago, which is our standard update on all the new contracts coming in. Two of them we got late, or they were surprised. DSHS is going through a reorganization where they've changed some naming convention, but the organization that funds our contracts under DD remain the same. But these came a little bit later. So next slide. The long-term payable agreement is the one that provides a gap payment between when the contract goes into effect and when we're able to receive the funds from the state. And it prevents any liability to the county. So we're able to draw that down if the contract came late and we needed to pay providers. The money wasn't available because the contract didn't come. We have not actually needed to use it. We've been really good at managing it. The state always provides it as a protection. So that's coming back forward again. We've never used it, and they always have to repay back to the state. It's one of those funds we have to hold and then repay because it's just a liability in case of a contract changeover. So that'll be coming to you to sign as part of the full package of the contract with DSHS. Next slide. And then the school to work contract. This one is, we didn't expect this, it came last minute. It's a bridge between school years. So they seem to do this every year where the contract ends. They don't take into account the school year not ending at a period. So this is the carryover to complete the end of the 2025 school year and then to move forward for the 2026 school year. This is the supports for individuals with developmental disabilities or intellectual disabilities that support is provided in school. This just makes sure that they continue that coverage as they transition from school into the community. So it's really just a bridge. Again, we thought they would just expand the contract to allow for it. No, they're just gonna throw another bridge contract in. So that's what this came in last minute, but it's just a continuation of that. So you'll be seeing that as well.
DVR stands for what again?
Division of Vocational Rehabilitation.
Thank you.
So again, it's all included under DSHS with all of their new names. And now the new one is DCCRB or something like that.
Stands for something.
Yes, but good news is it's all under DSHS, so that's all we care about.
Okay.
All right, next slide. This is a request. We not have the slide for the neonatal. We get that updated one. You go to the next slide. Let's see. Next slide. No, we don't have it. So there's an actual request in here. I don't know if we got the updated slide, so I'm gonna just put this forward. As you guys know, that Maddie's Place in the state contract did not receive all the funding necessary to continue operating at their levels. There was a reduction of the funding, although Senator Riccelli was able to get additional funding, and we are very thankful to the legislature for being able to fund an additional $2 million. It's still not enough to cover the existing services needed. Now, we were tracking this early in January. As the board may or may not be aware, we fund 20% of that ongoing service. The board approved this, so we actually fund operations on an ongoing basis, in addition to the one-time funding that you provided with opioid dollars. So that was to expand out housing, which they were able to purchase the land and they're beginning the process of building. But in addition to that, we also spend millage dollars to support operations. We've always done that, and that's made sure that they've been able to maintain funding. Because now we are aware that the state reduced funding, we're putting an ask to the board to be able to put a little bit more money in the next year to offset some of the loss of funding so that the existing babies that are there have a transition, so they don't have to have a loss of service or coverage. That would increase the existing amount of $594 to about $740,000, so it's an additional $160,000. This would just be for the next year. We would reevaluate. If at any point during that time, the state actually finally kicks in the Medicaid dollars, which is what we're hoping in the next year to a year and a half, you have a new Medicaid director. Well, it's not a lack of coverage, it's the ability for the state to put those into rules to regardless of the issues at the federal level, money is there and can be provided. We're hoping they'll do that next year. So this is a bridge to allow for that funding. If Medicaid does cover it, we'll reevaluate all funding to ensure that whatever money we're putting towards that only goes towards non-covered services. So we're not supplanting existing. We've been waiting for this. Again, we're asking for an increase in millage dollars to be able to cover it. There's enough money in our millage to be able to cover that. As a reminder, the board, millage dollars are those funds specifically tied to developmental disabilities and mental health. And the RCW for that is 71-20-110. It allows for the funds to be utilized based upon the determination of need. So the funding shift, we've always kept it at about a 60-40, 60% goes to developmental disabilities, and anything that's not spent is set and reserved for disabilities. So there is no liability to the county, and we continue providing the necessary services. We're asking to just use additional amount of the reserve to be able to cover that for the next year. Should not impact any services at all. We don't expect. There's sufficient enough reserves to protect that and continue DD. Even in the unlikely event DSH has reduced service funding, we could still bridge that gap for DD without any impact. So we're asking the board to allow for that just for the next year, an increase of 160. They're operating. As you guys may also be aware, the city also wants to give us some money to Maddie's Place in a one-time funding. They're doing that because we already have the contract and the administrative capacity. So they'll be passing the dollars to us. The board was briefed on this 2 weeks ago. They have a delay in that funding. Apparently, council had some disagreements on the use of other opioid dollars. So they delayed the entire package until July 14th. So we'll probably not see the ILA from the city to pass those funds until probably the end of July, maybe early August. It's kind of a soccer ball getting kicked down the field. So we're just tracking it. Again, the city's giving it to us to continue the work that we're doing. So this will be an addition. So that will all come before, well, this will come before the board sooner. Then you'll see the city's ILA come before you sometime the end of July. The goal here really is to bridge this next year to ensure the service is there until the state puts their funding to do. Any questions?
Commissioner Jordan?
Justin, is there any new information on the Medicaid implementation piece from HCA, or do we continue to wait on that?
On the neonatal abstinence syndrome, or like?
Yeah, on when and how the state may be providing for that ongoing funding.
It was our understanding that it is already at the federal level allowed, which is another state is already using it. One of the other Maddie's Place facilities in Ohio is already funding the majority of their facility with Medicaid dollars. It's the issue of the state of Washington including into the overall plan. That's the issue, and there was some concern by the Medicaid director that the service being provided needed to be determined whether or not the need existed in Spokane. Since Maddie's Place has been providing this, and we have provided additional funds to expand the service, the increase in neonatal abstinence syndrome awareness has gone up. So there is what? I don't know the percentage, I can't remember off the top of my head, but overall nationally, we rank one of the highest with neonatal abstinence syndrome impact. Now, I think it has something to do with the fact that we are taking babies from all of Eastern Washington and Idaho. So the need exists across this area. And also because we're the only facility in entirety of Western United States. So when you only have one facility and you acknowledge the need, sometimes it's not that we have a higher instance of it, but we're the only ones actually providing that treatment service. So we actually have numbers. So in that regard, I think the state is recognizing the need exists, but they're waiting on the new HCA director to come in and kind of set the tone of where they want to go with this. Again, they have a lot of decisions to make to include this. As you are aware, they're going to be seeing some cuts in the near future. So they aren't saying where can the funds be shifted to address that need. Regardless, the federal government has told the state it is a covered service. Congresswoman I think Morris Rogers insured that was included in the full package when she was in the House. So based on that, I don't see any issue at the federal level preventing the service being covered.
Is there any indication from HCA when the state decision might be made? I just feel like we've been talking about this for a long time and no decisions seem to be forthcoming, which is a little frustrating.
So there was a transition of a governor and an HCA director. Since the new ones have been installed, the governor's office has been made aware. I've also, I'm hoping that if the governor makes another visit here, that's part of the request that his office can come and see it. But we've made his staff aware, Maddie's Place has made his staff aware. They recognize the need in this. Mark Spichelli in his office, as well as a couple of representatives from our area, have made this awareness to HCA. They just, because the last director was coming out, they didn't want to address this until a new director came in. So I believe in the next 1.5 to 2 years, we will get an answer. I don't know to what effect. And even the MCOs aren't fighting it, which is unique. They would actually like to see some clarity on the coverage of the service. So as we look forward, it will be a part of our big ask to the HCA. And I do anticipate we'll get some answer at least in this next year.
So
Thank you.
So who does the decision to move this along lie with? Is it the new DSHS director? Does a WAC needs to be, is it rulemaking that needs to take place? I mean, or is this all just administrative to where somebody just needs to step up and sign the right document? I mean,
So-
it's just.
It's the governor's office and HCA. So HCA has to design what service code would be utilized. Right now, it falls under 2 weird areas. It's a medical and the behavioral health. Behavioral health can't be provided to an infant. The substance used for an infant, at that point, they can't actually be involved in treatment. So how do you do a treatment plan with a baby? But the parents can be involved in it. But you can't pay for a baby's neonatal abstinence syndrome treatment through the parent's substance use treatment. So the question is, where does it lie? We have said effectively the program should include both. Medical model for the youth, which is what the hospitals bill under, and then a treatment model for the family wrapped into one. They have to create a code, they have to create a rate for that code, and then DOH has to give a license to that facility to allow for it. Is it 2 different licenses or is it 1? And once that's all situated, then it can move forward. Now, the governor's office could push both agencies to make it a priority. Really, it starts with HCA to say it is a covered service. Once that goes into effect, then they can begin billing against it. And really, at this point, it does fall under HCA director. They could make this a priority or not.
Okay.
And really, I think the last one, this wasn't. And with some opposition from the Medicaid director, is what we had heard from Maddie's Place, it wasn't going to move forward. So I think we're hoping that they too can come together internally. You know, they had talked about a report needing to be done. The legislature said, here's money, do the report. They completed the report. The report said, you need to do this service. Then the state said, well, there's not enough information. We need more report. And so that's what happened. They delayed action on it. So this year we'll get a little bit more boisterous and we're hoping to get the commissioners involved. So stay tuned. If we can get the governor's office here and express the need, especially for this facility, we just heard 2 of another facility closed on the west side. And they've been bombarding Maddie's Place with saying, can you take these babies? Because there's no place to have them. And of course, we're limited in capacity. And the dollars that we're paying them can only pay for Spokane County residents. So there was some concern about who takes that on. Well, they just went to a hospital and then discharged it home.
If we get to November, December of this year and we still are in the same place, I mean, is this something that we need to talk to the legislators about running some sort of bill that forces this along?
That's the next step. I think
Okay.
when Marcus helped pass this last bill, his question was, we gave you money to do a study and now we're having to fill the gap again. What's the decision? I think there is already pressure at that level.
Okay.
I know Maddie's Place has been having a lot of conversations with various representatives. And we were waiting to see what the decision was before I asked Sean over there, the CEO, to get the board involved. Because he may be reaching out, asking for more support politically from you guys as well to say, hey, we need to make this a priority.
Commissioner Jordan?
Justin, do we still expect the city opioid contract to come through on this in a couple weeks? Is that still our anticipation?
I have not heard anything different from the city. All I heard was a delay because the council wanted to review an entire package of funding. This was included in that. But there was no opposition to the actual Maddie's Place funding, especially since they'll be passing it to us and we'll be doing all of the administrative work. It'll be included in our contract for the services that we already provide. So on
I
their
was
end-
going to add that to Commissioner Kearns's point, I'd be happy to do whatever we all can and be assisting with a legislative push if that's required. It might be a benefit to that push if city and county are both partnering on the facility. So it sounds like that'll happen. It's just a matter of time. So if there's any challenge there with the city, maybe we could do some outreach as well, but hopefully it'll be coming in short order.
Yeah, and I don't see any challenge with the city. The mayor was very supportive of this and has been from the beginning. It's just a matter of getting our messaging in alignment. So in this regard, in this very specific area, the city and county are working very well together.
Thank you.
All right, now we'll go over to the mental health sales tax and the selection of a provider. So we had briefed the board previously about wanting to do youth respite. This was last year. We put that contract out. That's one of the services that we used to provide, but then we stopped in 2019 with the switch over to, 2016 with the switch over to Medicaid. When that happened, the state said they would take it on. No one did it. And then there was a loss respite, except for some amount being paid for out of Providence to one of the facilities here. But that grant dried up too. And so that's why we put it forward to the board. When we put that out, we selected a provider. Provider then announced to us that there is no more money on respite. So the county's small amount would not support the ongoing funds. They were heartbroken on this, especially since we've worked very hard with them to develop it. They just did not see feasibility or viability with the program with the existing need and the small amount we were able to provide. So that ended up ending. So we came back with the board and said, we don't want to have these funds just laid to the side. We want to actually do something to support youth. And one of the key areas that the board has expressed is youth and continuing youth education so that they can obtain their high school diploma and then move on into the workforce. And also ensure that there isn't anything that would impact their ability to be active members of our wonderful community. So based on that, we explored various options. One of the key areas we identified was that youth support for those that become pregnant at some point during their high school year. That has a significant impact in their ability to be able to complete their education. So we said, why don't we look at programs to support that education and ensure that they remain in there? As you know, those individuals also have a higher incidence of other traumas and behavioral health conditions. So this was a great area to say we can provide that support, but there isn't a lot of funding for the educational, from the educational side, ensure that they continue and complete their education. And that's where this RFP went out to select a provider. So I'll turn it over to Ashley to give an update on that.
Thank you, Justin. Next slide, please. So we did put out an RFP, and this next slide kind of gives a brief history of when we closed down the youth caregiver respite and reapproached the board about this program and this plan moving forward. So we put out the RFP on May 12th and closed it by June 2nd. We received only one application. Next slide, please. And we compiled a selection committee, which is comprised of the individuals listed in the middle of the screen there. So a psychiatrist from the Sacred Heart's BEST program, Sean Cross, CEO of Maddie's Place, Jeanette Haynes, who's our Youth Behavioral Health Navigator Program Coordinator, a licensed clinician who does care coordination as well as a child mental health specialist, and Kim Taylor with our Behavioral Health Advisory Board. And we met on the 26th of June to review. The agency that applied was Lumen Public Schools. Overall, they received, it's actually 58.75 overall score. We had one other individual selected for our committee. However, they were only able to attend in the beginning and had to leave prior to scoring and review and discussion. And so we did not include that in our review. So that bumps that percentage up a little bit. On our RFP scoring, the agency either receives a 0 for not meeting, a 5 for meeting, or a 10 for exceeding expectations, meaning that out of
the individuals that scored, the total score that they could have received, if they received tens in all categories was 400, they received a 235. So if they received 5 in all categories, it would have been a 200. So in some categories, they exceeded expectations. Overall, we found that they had a lot of strengths and experience and readiness to take on a program such as this, that they already have a lot of connections to services and agencies in the community are doing similar work that could be expanded even further on the behavioral health front, and have a strong history of advocacy for the target population and a commitment to culturally responsive care through the way of which that is provided. And so we are requesting the ability to move forward with exploring contracting with this facility or with this agency. Expected that would start in fall 2025 and looking around the $180,000 funding.
Which,
Can I ask you to walk through the scoring again? I mean, just when I see overall score 56%, that doesn't look good.
It doesn't, no, and absolutely. And part of that is, like I said, the scoring is there was 8 different sections they could be scored in, and they either had to mark a 0, a 5, or a 10. And so 5 was meets expectations, 10 was exceeded, and a 0 would be to not meet expectations. And so if they received 5 in every category, that would be 200, a score of 200. And the score that they received was 235. If they received tens in all categories, that would be 400. And that's where the 235 out of 400 leaves us with 58.75%. That's where the score doesn't necessarily help identify what was actually scored during that scoring committee.
Yeah. The overall percentage doesn't identify, it's more they meant average. And part of the scoring and why we did it this way was in the past when a group score was utilized, having various iterations of points in between didn't really allow for us to be able to identify what the total group thought. In this instance, it was identified our project was very specific in areas, and Lumen School wanted to address those, but they need some assistance in building out some of that program. This is not an area of expertise in a lot of ways for the behavioral health side. They do a lot of the social supports. So this would be new to them, which was identified in the selection and review. The group was looking at it from the lens of, do you do behavioral health? And in this area, they marked it lower, which if it's a 5 or 0, if they did 0, that's why you see the score shifted that way. It should not be taken into account as a failing score, 100% being a passing, but more of their readiness to be able to take on the project if we implement it today.
Okay, thank you.
We would plan to address all that through our contracting with them.
And they are truly the best candidate for what we're looking at in this project. And really the only one that provides this level of care. But they will have a lot of administrative support to ensure the program is built out. So we're not concerned about that.
Okay.
Excellent. And I have 2 last things I would just like to add that aren't on the agenda. One that I wanted to make the board aware, CGATA funds. Board approved the funding for the providers in our last meeting, but I do want to make note that the state always sends out a letter every year asking the county to confirm that they want to continue to receive the dollars. Now, the board did approve that, but I wanted to make note clearly because I also know we have some new members and this might be new to them. So just as a reminder, by the board approving those funds and the CGATA, you also approved us to continue having that responsibility. That just means that we, county, will designate how those funds are utilized and then put out. If you decline that option, then it goes back to the state. The state would then designate the funds on your behalf. So that's why the board usually says yes to this, and it's then under our team, the actual CGATA committee, which gives reports back to the board, advising how to use the funds. It's made up of the prosecutor, the judge of the mental health court, or therapeutic court, and then law enforcement court coordinator, and then behavioral health team, and then a community member. So it's made up of a really diverse group of individuals, but they always advise the board makes final decision. So I wanted to make note of that. The board did approve it. If there's any concern or ask questions, but I realized I didn't pull that out separately last time. There's no questions. We've been doing this for the last 10 years. So status quo, essentially. We do anticipate possible reductions in funding next year, but right now it's status quo.
So on the respite contract potentially, so you're recommending that we move forward with Lumen?
Yeah, this wouldn't be respite, it would be the youth.
Pregnant and parenting,
Oh.
youth and young adult wellness education support program.
Yeah.
A mouthful, of course.
Okay, and so would they be providing services to any youth or just the youth enrolled in the Lumen High School program?
To start, it would be just within the Lumen School. We would work with them to discuss, do they have any authority within SPS to be able to provide that or capacity? Right now, that amount pays for one person essentially to provide care, so they are the highest need as well.
Right.
But we would work with them to discuss how that would work. And this area would be relatively new to them as well, so a lot of program building. And then the last thing, just as an awareness, congratulations to our Community Services Department team for 2 national awards. We won NACO Achievement Award both on our STAT program and our our transitional behavioral health program with the homeless population. So I wanted to note that for the board. Really excited about that hard work by our team to get those. That makes 5 awards now or 4 with national. So Spokane County continues to lead in a lot of areas, so really excited when you guys go, whoever's going to NACO, you know, chalk that up to Spokane County being a leader in the area.
Sounds good.
Awesome. Have a wonderful day.
Thank you. You too. All right, Lynn Kimball from Aging and Long-Term Care of Eastern Washington.
Great. Thanks for having me.
Of course, thank you for joining us.
Okay, so this is a little bit of an update. We're a little behind schedule this year because obviously winter and the beginning of this year was a little busy for a lot of different reasons. So we're coming around to give you our 2024 data and just a little bit about what we're working on right now. And just a reminder, we're your area agency on aging. And Spokane County Commissioner is a member of our interlocal agreement. So part of member along with the 5 counties we serve, the city of Spokane and city of Spokane Valley. And the goal of all of our programs and services is to keep people at home, keep them in the community. We serve older adults and people with disabilities. Next slide, please. And just a reminder, if you're ever working with someone who has questions about long-term care, about aging, how to stay at home, what kind of community services are available, our helpline for Spokane County is that 960 number there. So we do everything from helping people apply for benefits, what's available, what makes sense in their situation, whether it's private pay. Maybe they have resources to, okay, they need to apply for Medicaid or other services to get support to stay at home. And we do still provide specialty support in both dementia care and housing assistance. Because we did find over time, older adults, that was just part of and parcel of what we needed to build out in order to support people to stay in the community. Next slide, please. Okay, and this is the list of services. So beyond access services, lots of different things we provide. And that's why we do that helpline number, is it really helping people to navigate what that whole person's needs are rather than trying to navigate to each individual service. Everything from group meals at meal sites to veterans directed care for veterans who need support to stay at home, who qualify through the VA system, and Medicaid and home care is a big part and parcel of what we do as well. And then we also have groups of services that support family caregivers. So family caring for family, if there's an unpaid family member or a kinship family member, they're older adult caring for a younger person in their life. That all comes as part of what we do. Next slide.
Good
Okay.
question for you.
Yeah.
You go back to the previous slide. We're under caregivers and families where you go kinship navigator and caregiver support. Can you tell me a little bit more about that program? Because I didn't realize how much work it was to be a caregiver. And so I'm just really curious as to what services are out there for that.
So we in Spokane County are providers Frontier Behavioral Health. So they do our kinship caregiver support program, and that's for, it's oftentimes grandparents raising grandchildren, but it also can be another older adult who ends up with children in their lives because of, you know, maybe it's drug use or something, incarceration for the parents, and suddenly they have kids. And it does everything from the navigators help them figure out everything from how do you navigate the school system, how do you like find resources to navigate the court system, and they also have a pot of money to help with flexible supports. So maybe it's they need beds. Maybe they need help with rent because now all of a sudden they have to move into a larger place to fit everybody to, you know, like things for school sports and those kind of fees as well.
Thank you.
Oh, you're welcome. Okay. Next slide. All right. So in 2024, we served a little over 9,000 people in Spokane County. And it really a range of services. So generally anyone who gets a service often gets multiple services. So that's part of that screening is you start with, okay, where are they at? And then what else can you kind of wrap around the person to meet their needs? And our options counselors who answered that phone line, who do in-depth counseling, did almost 3,000 hours of just counseling with people. And that included close to 500 hours just counseling on dementia care. Because dementia care is just an increasing part of our community, and just as people are aging and aging longer, we're just seeing the rise in those rates of dementia in our community. Medicaid and home care, about 4,800 people receive Medicaid and home care services. So Medicaid would pay for a caregiver to come support them in their home to provide those personal care services. So bathing, dressing, help with housework, shopping, all of those essential services to keep them at home. We did see a little bit of drop in our senior nutrition program this last year. We've started to see the ramp down of resources we had from American Rescue Plan Act funding. And so we're kind of going back to that baseline funding we had before American Rescue Plan. So we saw close to 3,000 seniors served about 200,000 meals. We have seen increased state funding, so we'll be able to see that in our contract when we get it for July 1st. So that will help offset some further drops in the number of people we're able to feed and help. And as you can see, there's lots of different services. So everything from counseling people on Medicare, helping people with really intensive services for care coordination. So we do serve some of the highest risk people in the Medicaid and Medicare space who are in and out of hospitals, emergency rooms, doing care coordination and housing supports there as well. And overall, so this whole group of services, about $19.8 million were spent on services in Spokane County this last year. And then the piece that doesn't show up here in our books is how much gets authorized through the Medicaid program. So paying those caregivers that are providing services in the home, providing those other supports was about $264 million in just supports that went out to the community. All right, and slide please. Okay, so this is just our age distribution. So you can see vast majority of our agency is over 60. That kind of goes part and parcel with what we do, but there is a good percentage, 21%, actually 23% that is under the age of 60. So, and a lot of those individuals are in the Medicaid program. So about half of our Medicaid and home care caseload are under 65. And so those are individuals we'll be helping in the coming years trying to navigate work requirements and exemptions and all of those pieces that passed last week. And next slide, please. Okay, and then here's also race and ethnicity distribution. So you can see about 87.6% identified as white, and then we've got a range for all other races and ethnicities. And that's held pretty stable over the years. All right, next slide. And on the horizon, so the piece we're working on now and trying to get ready for launch is we've got a role in walk cares. So a good portion of the services are provided by the state. So they do have a department at DSHS for walk cares. The area agencies on aging are playing a role in implementation. So kind of everything from we've been doing outreach to local organizations to educate about the program. This is what it is. This is what you're paying into. These are the kind of things that'll be available under the program. The big piece we're ramping up to do is provider contracting. So there's a set of services that are going to be contracted by the state, and then there's a set of services that are contracted locally. So everything from dementia support, environmental modification, so working with local contractors to build ramps, bathroom modifications, accessibility modifications, meals, home safety evaluation, personal care through home care agencies, which we manage those contracts today through Medicaid, emergency response systems, transportation, and more. So that's a big bulk of work. So we have staff that have been working in the community to kind of get interest. We're waiting on the state to get all the application materials up, to get the contracts finished, and we'll begin contracting and registering providers in October. So it's just around the corner for us. Other piece that will be coming on board later this year for next year is beneficiary enrollment navigation. So we had lots of discussions with the state of, you know, people come to area agencies on aging on long-term care. If they come to our door, can we help them instead of just sending them to your door? So they have contracted part of those services to us. The big piece we'll be doing for everyone is the benefit navigation. So if somebody isn't able to self-serve, they can't figure out how the systems work, they really aren't sure what services they need. Even if they started in the state system, they'll send them to us to try to help people figure out what their options are, what services can they use through the Walk Cares benefit, what's available locally, and kind of navigate those services. The other piece that's different from the Medicaid system is if they come through our door to begin with, we can actually do eligibility instead of having to send them to the state and then waiting and trying to communicate with the state while they determine eligibility. So we're happy about that piece. It kind of gets rid of one of the bottlenecks you see in the current system. One of the big changes or big things for Spokane County is we actually will be doing a pilot here. So both Spokane County and then Lewis, Mason, Thurston counties is we are both part of the pilot to determine, kind of test out for people, do these work so people can actually get their benefits a little bit earlier. So it's we got to work with messaging on the state and what's agreed on for messaging. And it's only a pilot for up to 400 people across both areas. So it's not huge. But the idea is to give us all a chance to test how do the systems work. Are they actually working? Can you actually pay benefits? Is everything they're designing in the IT system and space actually making sense? Or are there things we need to switch in the workflows before it launches statewide on July 1st? So we're starting to meet with the state on pilot planning, and we'll be ready to launch that next year and start to work on staffing and building out the beneficiary side. I wanted to give you an update on that because I knew that's very Spokane County specific, and we're doing a lot of work in the community right now to talk to people about these services, and especially engaging businesses has been a huge part of what we're doing right now. So with that, I think the next slide is just questions, and just happy to answer any questions about what they do or what we have coming up.
Anybody have any questions for Lynn?
Thank you very much. That's exciting.
Yeah, I know. I was like, ooh, we get to do, they always come after us for pilots. That's what they do.
Well, that must mean you're doing a good job, so.
Yeah,
good
always
job.
fun. All right, well, thank you so much.
Thank you. All right, that brings us to Jim Maceo. Talk about some of the new legislation, changing the composition of the health board.
Thank you, Mr. Vice Chair. I'm going to hand out a new chart. I apologize at the last minute after the agenda had been published. Another option was brought to my attention, and so I'm asking Mr. Valencia if he's got that up there as usual. Thank you, Ron. And I'll hand this out just so you have a hard copy to mark on board members. And then I've got, if I could, we can pass this around. Joey, you want one of these? Oh, you're good? Okay. Okay. Thank you for your patience while I hand these out. I've tried to make this chart self-explanatory, and I think it's pretty easy. Firstly, let me start out by saying, as the board is aware, the 2024-25 legislature modified the composition of local regional health districts. And regardless of whether or not you're a department, you're a 3-county commissioner district, a 5-county commissioner district, or a home rule charter organization, your health district board has modified the composition of the board. And so and the modification becomes effective on July 27th, 2025, which is about 2 weeks away. The change deals with the a number of members from, if you will, tribes and organizations which have the ability to be on the health district board. At the chart I've given you at the top, I have 2 boxes. The first box indicates the present composition of members of tribes and organizations which must be on the regional health district board. The second chart shows the changes. The first chart, if you look at what I bolded, prior to the legislative change, there had to be 1 tribal member from a federally recognized Indian tribe or an organization registered in Washington, which serves the American Indian and Alaskan Native people. There was a lot of discussion about whether or not the present legislation provided for 1 or more than 1 representatives. Some counties said it would provide for more than 1, others said 1. In Spokane County, the Board of County Commissioners establishes the composition of the health board. And at that point in time, it was a position of the Board of County Commissioners legally under the present law that only 1 tribal or organizational member could be on the health board. The legislature modified that. And on the second box, which I've shown you on the right-hand side, the health board now will include as many members from each federally recognized tribe and as many members from each, if you will, organization that want to be on the health district board. So the legislature made it very clear that more than 1 will be allowed to be on the health district board, depending upon the number of federally recognized tribes or organizations that are in Spokane County. So the second chart below that, board members, I've done several things to give you some food for thought as you give me direction on how you would like to amend your resolution establishing the health board. On the first chart, board members, I've indicated the present composition of the health board. And as you'll see, there's 3 county commissioners, 1 elected city town representative, and that person is presently from the city of Spokane, 1 public health person, 1 consumer of public health, 1 other community stakeholder, and 1 tribe member. And as the board is aware, the 1 public health person the one consumer of public health, and the one other community stakeholder are all statutory requirements. As of January 27, 2025, the composition of the health board will automatically change. Remember, you cannot have more elected representatives on the health board than non-elected. So as of July 27, 2025, I have eliminated, if you will, the elected city county representative because we have not yet been notified by any tribe or organization that they want membership. And I have eliminated the one tribe member, which we presently have, because again, we have not been notified by any tribe or organization that they want membership. Let me stop here for a moment and make this statement. The law is not crystal clear on how a tribe or organization evidences it wants to be a member of the health district board. The law seems to suggest that the tribe or organization notify the health district board, and then the health district board will notify the American Indian Health Commission. That appears to be the appropriate way it occurs under the new legislation. Okay, so now, what are some options for the board? Pardon me, Madam.
Or is it go that way, or does it go through? I'm confused, because we just talked about it last week at the or 2 weeks ago at the Board of Health meeting. I thought that they had to go through the Indian Health Commission so you're saying they apply to the health district and then it goes to the Indian Health Commission to confirm that they're like, I don't know. Anyway, I think maybe it's the other way around.
Commissioner, your point is very well taken.
I think it goes to the Indian Health Services to, I can't remember what it was.
Present day or the new, I don't know what
New
the new
one.
legislation,
So
I don't know.
I will tell you this.
Anyway,
I looked at the legislation board member.
it was confusing, I bet.
I looked at the House report that discusses this. I talked with the attorney for the health district, and as a result of that, as I've indicated on the bottom in the note, the way the legislation presently reads, the tribe or organization lets the health board know of their new member.
That sounds like what we talked about.
Then with the health board, then it notifies, if you will, the American Health Indian Commission. That's the way it presently reads as I understand it. And I did talk with the Health District Board in that regard. But I would admit, Commissioner, it is not the best written legislation.
Okay, that I think that sounds like what we discussed briefly a couple weeks ago, yeah.
So let me say one other thing before we talk about how the board would like to change the composition of the local board of health. The law provides that when a tribe or organization advises the local health board that they want a membership, the health board has 60 days, up to 60 days to add them to the health district board. And why is that important? Because when do they start to vote? Those things, okay. But the law goes on to say the 60-day time frame is only good until the State Board of Health, within a 1-year window, comes up with their own rules as to when the new member appointed by the tribe or the organization will take office.
So, I want to make sure I understood. So if a tribal member expresses a desire to sit on the health board, they share that with the health board, but isn't it up to the Board of County Commissioners to create that position and not the health board?
No, Commissioner French, the state legislation is still self-executing in that respect. And it makes it very clear that I'm using the word tribe very generically and organization very generically, but the board knows once the tribe determines who they want on their membership, then they advise the Board of Health. It automatically, within a 60-day window, that individual becomes part of the local Board of Health. It's automatic. The Board of County Commissioners does not need to approve whomever that tribe or that organization appoints. It's automatic.
Follow-up question then. So if the Board of County Commissioners determines that to maintain the appropriate balance or relationship on the health board, they want to add a new member to the health board, let's say a county commissioner, that's a decision of the Board of County Commissioners or the health board?
That's a decision of the Board of County Commissioners, and what I've tried to do, Commissioner French, is in option one, which we're gonna discuss in a moment, and option two. Yes, and answer your question, the county commissioners will determine who that elected representative is, Commissioner French.
And the legislation says for every tribal member, you then have to appoint a elected official member.
Okay.
Is the 60, when does the clock start on that?
I believe this clock would start, Commissioner, when the tribe or organization gets notification to the health board that they want to member. That is
Then this group would then
appoint
appoint the
someone.
next. Okay,
Exactly.
got it.
Okay.
So now, Commissioner French, your question is a good question, and Commissioner Kearns, I've talked with Commissioner Waldruff on one option, and the other option is one which Commissioner Cuny suggested I also put up for discussion this morning. And the reason I was working with Commissioner Waldruff is because, as we know, she's the chair of the Health District Board, and she's very familiar with the nuances of the board and the present composition. And Commissioner Cuny, when she saw option number one, she suggested for the purposes of discussion that I put option two on there to get some input from the county commissioners. So now if you go to my chart again, at the bottom, let's look at column number 3. So here's what Commissioner Waldruff and are suggesting. Let's say a tribe or an organization gives a membership, the name of a new member to the Health District Board. At that point in time, the first new elected representative on the Health Board would be the city of Spokane. The reason we did that is because that's where we presently are board members, and we were thinking you'd want to get back to where you were. So let's say in 60 days, let's say the Kalispell tribe sends the name of their representative to the health board. As soon as they send that name, then the county commissioners would appoint another elected representative back on the health board. And so my chart number 1 says the first person that you'd appoint would be a city of Spokane representative, only because that's where we are right now. Let's say a second tribe or organization sends a note to the health board that they want a representative. The next thing we did was we added another county commissioner to the health board. So you'd appoint a 4th member, if you will, to the health board. Let's say another tribe, and Commissioner French, I'm getting to your issue in a minute, another tribe or representative.
Different options.
Another tribal organization says, here's our name. The next individual would be another county commissioners. So I assumed, board members, that since the Board of County Commissioners is the only public entity that provides financial resources to the Health District Board, that my way of thinking, and Commissioner Waldruff understood this, that you'd want to have as many board members on the Health District Board as possible. So again, you'd start by adding 1 city county representative to get us back to where we were. Then the next 2 we'd add when there's a tribal or organizational members would be the 2 county commissioners. Then we'd go to the cities and towns again if there was another tribe, and there'd be city county representatives. So that's the option that I came up with. I know at one time.
Can I just
Yeah.
insert that? So I didn't think about this until I sat down and met with Jim about looking at these options. That as of July 27th, we would be out of, we'd have to remove the current, this is the proposal, remove the current city representative. Because we'd be out of compliance with the state law that says you can't have more electeds than non-electeds. And then Jim, so I didn't even think about that till Jim brought it forward and said, well, one option would be to remove the city representative, which currently is Councilman Cathcart, and then put him back on as soon as we have a tribal representative that has been sent to the health district. But it makes it a little awkward because we have a meeting on like July 31st, but I don't know what else. If there's other ideas, that's fine, but I didn't even think about that. Then we'd have to change it and then, because the state law comes into effect like in the next.
All of a sudden,
3
it comes
weeks.
into effect
Yeah,
on a Sunday, I believe, Commissioner Waldron.
so anyway, that's just a little nuance. I just was gonna bring that up, because currently he's the vice chair of the Board of Health.
So when I was on the health board, you know, one of the things that I was pushing is that, at the time, the only organization that financially supported the health board, locally was the county. And so I was pushing that, you know, if we wanted to have it a county-wide board with the city of the Valley and Spokane, yada, 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 that they ought to be kicking in some cash too. And, there is an effort led by Mayor Freeman to try and put that together. And then at the last minute, it fell apart, and then state law changed, and here we are. But if we are going to go back to a model that says that we're going to have other jurisdictions part of the health board, I would go back to saying, yeah, you kick in some money and you buy a seat, kind of a deal. Because otherwise, we could end up, and this was the situation when I was on the health district, was that the Board of County Commissioners was outvoted in setting the budget that the Board of County Commissioners had to meet. And we're kind of going, wait a minute, this is backwards. Why do we have all of these other jurisdictions setting a budget for the health district and forcing the county to come up with the money to meet it? So that would be a concern that I would continue to have is, you know, if you're gonna sit at the table, you gotta have skin in the game, kind of a deal. So.
Commissioner French, one other option with regard to putting 5 members on the board, which is option 1 that I proposed. I think one of the issues we've had in the past, Commissioner French, is board members, you go to a lot of meetings. And Commissioner French, at one time, you were on a state commission that met almost the same time as the health board. So you said, board members, I don't think it's appropriate to put me on the health board because I won't be able to make the meetings. And so as a result of that, I think there's an option 2 here. So option 2 is a little different than option 1. And option 2 was a suggestion that Commissioner CUNY had. And Commissioner CUNY's suggestion for the board's dialogue was, as a tribe or organization gives it membership to the health board, you'd fill with elected officials in the following sequence. First would be a representative from the city of Spokane. Second would be a representative from the city of Spokane Valley. Third would be a representative from the small cities and towns. And I define small cities and town in the document to be the city or town other than the city of Spokane Valley. And fourth and fifth is when you add the county commissioners, and then the sixth, you go to cities and towns again. So she suggested a little change structure for discussion purposes.
Yeah, and I don't have any real issue with that structure as long as those jurisdictions are kicking in money.
Commissioner French, this issue was one, Commissioner French, which was raised previously. And I think legal counsel then reviewed it. And I think as much as your suggestion has a lot of support, I can imagine. I think it's very problematic the way the legislation is presently drafted, particularly the new legislation, to indicate that a city or town cannot have membership on the Board of Health unless they want to financially participate in the composition of the funding of the health board. So I think as much as I'd like to support that legally, I think it's very hard uphill battle, Commissioner French, and so I would say right now, I'm sure that Mr. Folsom will revisit that issue, but I think it'd be very problematic to put that in the now, could we put in language that any city or town that wants to be on it and wants to voluntarily contribute, we will add to it? You could do that, but remember, you'd have to add another non-elected representative, so you don't have more electeds than non-elected. So you could do it the reverse way, Commissioner French, that any city or town that wants to financially participate, we will add you to the health district board. I think there's nothing making voluntarily. I think we can do that, Commissioner French. In fact, I think at one point in time, I actually had legislation drafted to that effect for the then Board of County Commissioners consideration. So
I would be opposed to adding other jurisdictions that don't have any skin in the game. You know, that's longstanding from my standpoint. I'd go back to that. But, you know, if adding me back to the health district board allowed for option one to continue, I'd be happy to do that. It's just, you know, going to be realistic. You know, I'll show up like I did before for the budget, and that would be it, because I've got 3 other boards that all meet at the same time. So, and we get money from those other boards. We don't get money from the health district.
Commissioner French, may I just address your proposal? You're saying, Mr. Maceo, what I would propose would be take present composition, and as each tribe or organization notifies us of their membership, we'd increase the health district board by adding back the county commissioners, so we'd have 2 more. And then let's just happen to say, Commissioner French, that we had more than 2, if you will, if we had more than 2 organizations or tribes indicate, then who would you add? It would have to be other elected officials. Or you could have non-elected officials. You just can't have more electeds than non-elected. So you could have an individual from the community.
I thought the legislation read, though, that for every tribal appointment, it was an elected. Really?
No, it doesn't say it has to be elected. I'm sorry, I didn't mean to put it that way. As I read the legislation, you just cannot have a total of more electeds than non-electeds. That has never changed.
But we only have 2 tribes in the county.
Well, Commissioner French,
And we have Native Project.
you ask a good question. I can tell you right now, we're gonna have a 3rd one because the Coeur d'Alene tribe has made a request to change property from fee to trust. And if you look at the definition of a tribe, it's a particular tribe that has reservation land or fee to trust. And so if this is approved, the Coeur d'Alene tribe will potentially have membership on the Board of Health. So there could be more than just 2, Commissioner French.
So where do they want to be part of Spokane County yet?
The Board of County Commissioners last Thursday received notification from the Bureau of Indian Affairs that the Coeur d'Alene tribe had requested to change approximately 50 acres from fee to trust located in Spokane County. The purpose of the change, Commissioner French, is to use it as a conservation exchange property, if you will. So my point in saying this is we haven't even briefed the board on it yet because we're still putting together the necessary briefing material. But it's been our experience, Commissioner French, that the Bureau of Indian Affairs routinely approves fee to trust applications. And with regard to organizations, we know we at least have one organization, and that's the Native American Community Center. So, but there's going to be others, Commissioner French. I tried to determine by calling around how many tribes and organizations we had. And all I could find out, Commissioner French, was the Spokane tribe, the Kalispel tribe, and the Native American community. So those are the only three that I know for sure, but there's probably others, Commissioner French.
There's a total of 4 tribes and the Native American Project.
Yeah. So I'm all ears to get some direction from the county commissioners on how you'd like me to draft your resolution.
Commissioner Jordan?
I was just gonna ask the same question about the numbers. Do we know whether there are any additional recognized tribal organizations? It's only the Native Project that we're aware of, but is there a way to determine if there might be others?
I think both the health district attorney and myself have tried to quantify that, Commissioner Jordan. And neither one of us have been able to quantify that any more than Commissioner French just alluded to. So I apologize.
Okay.
That's all the information that I have.
That's all right. Thank you.
So the UCUT, as I remember, the UCUT has 4 tribes. You've got the Colvilles, the Nespers, Spokane, and Kalispels. You go outside of UCUT, then that adds the Coeur d'Alene tribe to it. So you've got 5 plus the Native American project. So you've got potentially 6 organizations.
But would they, if they have federally recognized trust lands or reservation in the county?
Well, but the Coeur d'Alene is out of
Well, if-
Idaho and they're gonna,
Well, if.
so I mean, any tribe can come into this county and buy land and declare it trust. I mean, the Bureau of Indian Affairs has been very generous with regard to allowing trust land.
But probably right now, there's at least 3. Kalispel, Spokane, and the Native Project that would likely be very, they would all be eligible, and there's maybe one other. There could be other Native American organizations, but they would have to be recognized by the Indian Health Services as providing health services, I guess.
That is correct.
So, and I don't know how many, but let's say at minimum, it seems like there's 3 likely additions, maybe more.
And of course, Commissioner French, what you alluded to when the issue came up with the number of county commissioners on the health board, it's critical that hopefully that all members can participate as members of the health board, and everyone's schedules, of course, are pretty fixed, and so the tribes and the organizations will have to advise their members that they need to adjust their schedules to be at the health board meetings.
So when I'm reading the report from the bill that was passed this year, the number of members from the 3 categories, including the tribal members, is equal to the number of elected officials.
Yeah.
So you were saying you could add more other community members, but you'd still have to add then elected officials.
That is correct.
Okay.
That's correct.
I was just clarifying,
Yeah.
because I think you were trying to say you could add more community members, but actually you have to do the elected officials have to be equal, but
So
not greater than.
if July 27th rolls around and we haven't heard from any of the tribes, we just wait.
Yeah.
And then say,
But we would have to remove one of the elected officials.
do we know, has any of the tribes or the Native Project sent a letter to the health district?
Interesting.
I think Dr. Thompson just said she announced a week and a half ago, like how they could contact the health
Okay.
district and, who to contact, and she would work with Michelle and Ann, the secretary there, to, accept the
Commissioner
information.
Kearns, yeah. As you know, the Board of County Commissioners establishes the composition of the Board of Health. And so what I've tried to do is I would take the present composition of the Board of Health in your resolution, and I would modify it with option 1, I change the language, or option 2, or whatever option you tell me, so that it is self-executing as of July 27th, 2025. That was my hope, that I would do that.
So do either one of you or Commissioner Jordan, if I'm going from memory here, so, I believe the Kalispells, the Colvilles, Spokane all have health clinics on their reservation property. And stuff, and I wouldn't be surprised if Coeur d'Alene doesn't either. But if they've already got their own health districts, why would they want to be part of the counties?
This just allows for that to happen, but I don't know if they will all send names our way or not.
It wouldn't be
Yeah,
the first time someone that doesn't know what the health district does pass legislation to change the health district.
Oh, I know.
well, and I can't answer, I can only speculate, but I would imagine that the tribal organizations may choose to sit at that table because they have a significant number of tribal members that don't just live on the reservation, but live all throughout the county.
Mr. Waldruff, I've been advised by the Kalispell's attorney that they do intend to nominate someone to a member of the Spokane Regional Health District. And as you pointed out, Commissioner French, they do have portable services right on, of course, on their reservation, and they have experience, which I believe they can bring to the Health District Board on the present services they're providing that might be beneficial to the health board. So that would be one reason why they would want membership on the local Board of Health. So one further thing, my legal opinion would be, if you do nothing by July 27th,
Probably not a good
from a
idea.
legal perspective, I would tell the board on July 27th, 2025, automatically, the city of Spokane representative would probably be off the health board unless you want to take one of your own off. But you'd have to reduce it so there'd be equal
Or you
membership.
could add
electeds
a
and
community
non-elected.
member to even it out.
Say one more.
You
time.
could add a community stakeholder to even it out too, but this board may be getting larger and larger. Could be back up to the same size it was.
Yeah.
What do you think, Commissioner Kearns?
I mean, ideally, we'd have an application in hand from one of the tribes or notice that a member is joining and we'd be good, you know, and then it would just be waiting to see if we get additional tribal members that want to join, and then we select another elected to join. Yeah, no, I mean, my concern, I mean, we have a city member who's in their second year on the board, is an engaged member, chairs a subcommittee. I mean, yeah, it's
I know,
kind of
it's-
crappy to be like, okay, you're off for a month, wait, and maybe you'll be back on next month. kind of
Depending
thing.
what option
Which-
you select.
Yeah, so,
We don't meet in August, so
I
So
guess you're-
potentially,
I guess you're right there.
it might just be one meeting and then back on in September. That's why I thought Jim's idea on option one wasn't a bad idea, because it puts the person back on that we had already appointed. And then it adds county commissioners, since we do have the fiscal responsibility.
So, and I would agree with you. I like 1/2. But the question for you, and it's been a while since I've sat on there, but does the health board has its own set of bylaws. I know that we went through and we scrubbed that and yada, yada, yada. But I'm just floating an idea. I'm not even sure it's a good idea, but I'm floating an idea so that we can maintain that fiscal alignment between the health board and the Board of County Commissioners. Does it make any sense to go in and amend the bylaws that says that the annual budget for the health district is established by the sitting county commissioners that sit on the health district board? That way you maintain that fiscal alignment. And then the other membership doesn't really matter. If it ends up continuing to grow, because, you know, shoot, I can remember when I sat on the health district when we represented the city, there were 17 members on that board.
Aren't there some things that only the commissioners get to vote on with the current bylaws? It seemed like there were some changes since I used to be on years back. Wasn't there a time that we voted on the budget and it was just the commissioners and not the elected, the
I
unelected?
think the budget.
There's
I
something
think
that, but
we
there's been at least
voted
one vote.
on-
There's something.
It
in the
had something to do
bylaws.
with the membership. It wasn't the budget.
Oh, it was about the
I
membership.
think it was about the membership.
There is something in the bylaws.
And I think that was because it wasn't, like, we didn't. And I'm, yeah, something I'm certain it wasn't the budget, but I do remember there was something where we said the non-electeds can't vote on this
that was
item,
me.
and it might have been to seat the non-electeds or something, and so it was
Oh,
like,
to
you can't
approve them.
vote because you're not on the board yet, so you can't, and it might have only been Charlie who was the holdout, who was the person who had served 2 years. We had to sort of vote to affirm him or something. I think it was just, it was something to that effect, I think, but no, it wasn't the budget.
Well, that's just, I mean, I just wanted to get this on everyone's radar today, because we have 2 more weeks. We gotta adopt it by the 21st, because that's our last meeting before the 27th. So we have a couple weeks, we can think about it this week and look at different options. I mean, another option could be a middle ground where you start with the city, then you do a county commissioner, then you do another city. I mean, there's a lot of different options, but we just don't want to have to reopen this every time there's a new appointment. So that's what Jim was trying to do, is set up a schedule so that then it just happens without us having to reopen the resolution.
Commissioner Jordan?
So just to clarify for myself, so the three kind of community seats, those are statutorily required other than the current city. So just doing some math, if we think that there's at least those 3 seats and then potentially 3 or more tribal applications, we would need to have most likely 6 or more elected officials on there if that occurs, correct? So even if all 5 commissioners were the first 5 elected official appointments, it's just likely we're going to need to go into the city pool, cities or towns, in order to make the math work statutorily. Just an observation.
Well, and Commissioner Jordan, that's one of the reasons why I was suggesting, you know, maybe a bylaw change that says, you know, whether you got 3 or 5, it doesn't matter. Commissioners, that those are the ones that vote on the budget, so that there's, I mean, you know, when I was on there, we had there was an imbalance, and we had the other jurisdictions adopting a budget, knowing that it would come to the Board of County Commissioners and we would have to fund it. And then we ended up with this conflict between, we don't have the money to fund your wish list. And that became more and more apparent. And that's been, you know, Mayor Freeman started to say, well, maybe we need to kick in more money. The cities used to kick in money to support the health district until Initiative 695. And when they got rid of the motor vehicle excise tax is when the change in the funding model for the health district changed to where it was all county and not cities. Prior to that, cities participated as well.
No, I appreciate that. I was just trying, and that's helpful context. I'm not necessarily arguing with your point. I'm just saying mathematically, we're probably going to need to include some city or town representation. And then, you know, we are going through a budget process now where we're actively engaged with the health district on what that contribution is. And at least it's been my understanding that we're not legally required to give them a certain amount. We may be legally required to fund at some level, but we retain the discretion, I believe, to set, at least at some level, what that amount is in any event, regardless of what the board makeup is. But I guess that's a question for Jim.
That is a correct legal interpretation, Commissioner Jordan, of the present status of the legislation dealing with the county commissioner's responsibility to legally fund the health district. It doesn't indicate the amount. It's up to discussion by the health board and the board of county commissioners.
Except for TB.
No, well, TB is separate. Excuse me, Commissioner French, you are correct, except for TB.
Right, right. Thank you.
But Commissioner Jordan, so to your point, that's option one starts with the city and then has the county commissioners. Is that what you were getting at? That you'd have to have at least one, we should plan for at least another city representative.
Do we, I mean, I'm looking at option one and number two, two kind of directs which city you go to. Do we want something like that as a part of option one?
Like a
that
rotation or something.
The first city town is City of Spokane, the second city or town is the Valley, maybe if there's a third, it be something other than Spokane or Spokane Valley, I mean, to try to go around the community and bring in, you know, I don't know, I'm noticing that's an aspect of option two. I wish Commissioner Kinney was on here, we could ask what the thought was on that, but.
Yeah, the only challenge you have with going through a rotation.
Yeah.
Is, you know, that's assuming on every
that they want to be on.
That they want to be on it, and you could end up being forced to take somebody who doesn't want to be there, as opposed to being able to provide an opportunity for somebody that's really got a passion for it.
Yeah.
So, you know, I think back on Liberty Lake used to have a dentist on their city council who had been an excellent member of the health board, but it wasn't part of the cycle.
I should point out, board members, also, cities and towns have other elected individuals other than council members. And the way the law is set up is any elected representative from a city or a town. So it might not be a council person, a treasurers, I don't know, each one's a little different. Clerks, I don't know if they're elected or not, but that may make a difference.
Okay. But county electeds have to be the commissioners, correct?
That is correct.
That are appointed?
Okay.
Yeah.
Well, what do we want to do?
Want to mull it over for a week, come back? Next.
Yeah, I mean,
I
yeah,
agree
option
with
one.
Mr. Waldron, I like option one.
Yeah, I don't see any drawbacks.
Maybe we could
One, but-
set up a process where we take applications for the city county seat every 2 years or something, so that you could give an opportunity for, if there is somebody that has a public health background or is a physician or something that, you know,
Yeah,
might be more interested than others. Just a thought. But we could, do we have to have that in this resolution, or could we set up that process
I
separately?
think we need to spell that out. Commissioner Jordan?
Do we have the ability to come back and kind of tie it up next week in discussion?
Be a good idea.
yeah.
We want to put it.
Are we meeting this week?
Yes, yes, the next 2 weeks.
Be surprised if it weren't.
Last week in July, first week in August, we don't meet.
Thank you,
So,
Commissioner Waldron.
Any changes, so get changes to Jim
Um,
or suggestions, and
oh.
we'll bring it back next week.
That'd
And
be
hopefully
fine.
get it on
Yep.
get it on the agenda for the 21st. Right?
That'd be fine, Commissioner Waldron. Okay. And if the board has any individual questions, please feel free to give me a call and I'll try to shepherd you through.
Could we have it on the agenda for next week instead of the 21st? Because
Just in
I'm
case,
gonna be,
just in case, like,
well, I've got an STA conference I've got to go
Oh.
to, and I won't be here on the 21st.
it would be better for me next week as well, because I'll be zooming in
Yeah,
and just, you never know with, my daughter's at a competition and I should be able to zoom in on the 21st, but you never know.
you never know.
So what I'm hearing is that we'll do a final briefing in the morning with option one, with that on the
The
legislative.
22nd.
the legislative consent agenda
Well,
on the
now
Tuesday.
remember, we have to place on the agenda what you're gonna act on, so I'm gonna put option one on there as we presently speak. And then remember, once it's published, if you want to change that at your legislative session next week, you're gonna have to open it up for public testimony.
It's fine.
So
That's fine.
thank you very much. If you have any questions, please feel free to give me a call.
Okay, that brings us back to miscellaneous. I notice we do have two items under miscellaneous. One says boards and commissions, then the other one says July 21st budget meeting. Does anybody wanna?
I can cover those. Commissioner.
Okay.
So boards and commissions, a reminder that, or just a friendly reminder, there's a number of applications in for a variety of your boards and commissions that need some review and sign off to get those appointed. Shelley sent out an email, I believe, last week of that list. One particular commission I want to point out is the the Accessible Advisory Committee. That is a board that is comprised of 22 individuals. Only 3 individuals have applied so far and have been appointed. That leaves 19 remaining. They will, once they get to a point where they can begin meeting, they will need an individual to kind of facilitate meeting time schedules, making sure the meeting notices go out, meeting minutes are done. This is a externally facing committee, not internal to the county proper operations. So I previously recommended that the board consider one of their assistants to be in that role. So that's another outstanding item that needs a decision point. So if you have one of your assistants that you want to provide as that liaison, please let Gina know so she can get them what they need to do to get it set up. And then
what kind of flexibility do you have in your schedule?
I do what the board wants me to do.
All right, let's put a pin in that. We'll circle back next week.
Right. Sounds good. The second one is on the July 21st meeting that the board had requested to have a follow-up with the elected official department head meetings for budget conversations, looking to see what content or what kind of structure you're wanting for that. What do you want to cover? What do you want to accomplish? Keep in mind that every department, they're not required to provide, their budget deadline submission is the first week in August. So we will not have any we won't have complete budget submissions to share with the board for you to be able to look at and say, okay, here's what your target budget is that the board set. Here's what's been submitted, to have meaningful dialogue. So I just offer that up as far as planning for this. We can put something together, but I'd really like to hear from the board what it is you're wanting to accomplish in that meeting.
If I remember correctly, and Commissioner Waldriff, Commissioner Jordan, correct me if I'm wrong, that this was the date that Commissioner CUNY threw out. I thought to allow the other elected sort of that final week or so to kind of ask us, or kind of what,
Like a workshop
kind
where
of
they
more
were.
guidance on what they need. Was this sort of that final 7th touch we were talking about? You know, you gotta touch with them, 7 times until they understand that, hey, revenue's flat. You have to submit a flat budget. But I mean, Scott, is that what you remember? That this was sort of that final touch, or if they had questions on the process or something like that?
I think we've more than touched this 7 times. I think the one that we had the elected official department heads join your meeting a couple of weeks ago was probably about the 8th time. Now they've received the letters, which is the 9th time, and each of them are reaching out to the budget office if they have questions as they're preparing their budget. I'm not sure what more we could accomplish in that. unless they wanted to ask more questions of you all, but I think you got a flavor of the questions during the last time. I think there's going to be a lot of value as they submit their budgets. And the board gets a chance to look at the preliminary roll-ups before the September 2nd or September 1st, the September 2nd preliminary budget due date, to start bringing multiple departments in every Monday. Consider having morning and afternoon meetings on Mondays, and scheduling, 2, 3, 4 departments in the morning, same in the afternoon, and to start really going through their budget. And the structure that we've set out is, here is your target, here's what you submitted, and here's, in order to meet your target, here are the things that are not going to be able to be delivered, and here's what the cost of delivering those is going to be, so that it informs on your decision making once we move towards final budget.
Commissioner Jordan?
Yeah, as I recall, it was Commissioner CUNY was the one who threw out the idea. So perhaps we could chat with her if she's at the meeting tomorrow about kind of what she envisioned. But my recollection was similar. I don't think that there's necessarily a lack of clarity in the departments about what the expectations are, maybe more of a discussion or a workshop on how departments plan to carry out that limitation on the budget. Are there certain departments who've come up with creative ideas for savings that they could share with their fellow department heads in kind of a idea generation? Maybe there's beneficial ideas that come out of a discussion about how particular departments are looking at implementing those funding levels. And then I think the second possibility was, are there any opportunities for creative solutions across departments to save money that don't just kind of look at it in the siloed, look of your individual departmental budget. So kind of cross-departmental collaborations that might allow for sharing of resources, that type of thing. So those were just in my mind, what some of the possible benefits might be. But that's just my recollection of some of the ideas that were discussed.
And just this meeting on the 21st, I know 2 weeks ago we had the Zoom call, the department head elected official meeting over the lunch hour. This one on the 21st is just the elected departments. Is that correct? Or is this electeds and department heads?
It would be all of them.
Oh, see, I thought this was just the electeds, was what this one was going to be.
Oh,
I don't know. I could have that wrong. That's what I thought Commissioner CUNY had presented, it was the electeds, because I thought we were kind of counting off, to decide sort of how large of a room we would need to hold that. And so we were counting off all the electeds, the judges, maybe I'm remembering that incorrectly, but.
I don't recall, Commissioner Kearns. I kind of seem to recall it was everyone, but I don't know for sure. I think if what Commissioner Jordan mentioned around sharing ideas, idea generation, shared resources, how are others solving on it, I think that would benefit all of our elected officials and department heads.
No, and that's why I brought that up, because I was thinking if it's only the electeds, we're going to have a lot of departments not represented that could be a part of that cross department, cost sharing or savings like that. So,
and our idea was to have this over the new Public Works facility. They've got a fairly large training center that should be able to fit all of us in there. So I don't think the room will be big enough. But we are planning on having this in person, not a Zoom call.
Okay. So can somebody circle back to Commissioner CUNY and I think Commissioner Jordan's idea was good. I mean, because this was her concept to have this on the 21st and just make sure we're not headed in the wrong direction. Scott, if you could reach out and then share with her what we've discussed today, because I think we've got a good idea we've discussed here on how this could work, and just make sure that's in line with what she was thinking.
Will do.
Just to recap, Scott, you're suggesting doing it later. Doing the conversation later.
I wanted to know what the board was expecting for that meeting and what kind of value you saw out of it. We're already going to have planning on bringing in departments in that you want to have present their budget, which I suspect will be quite a few more this year, given the budget projections that we have and people having to meet their budget targets. So those are going to be more valuable when they've actually submitted their budgets. But I can see where there could be some value early on for individuals to share how they are meeting their budget targets in their initial budget requests. But just understand that on the 21st of July, we will not have any material to provide to you because the departments and the electeds are not required to submit their budgets until the first week in August.
And you said you're not gonna be here on the 21st?
To fly that day. I'll be able to Zoom on the 22nd,
Okay.
but
And you're not gonna be here on the
21st.
21st? So it could just be Commissioner Jordan, CUNY, and myself there on the 21st, but.
Okay.
Or it will be, unless Commissioner Jordan or CUNY are not. I will be here.
I'll be here.
Chris and I will be here at least.
And Scott, how long are you currently anticipating the meeting to be?
Again, kind of depending upon the content, what we're looking for, will determine that. So I haven't had a predetermined time in mind.
Okay. No, and I appreciate the heads up on the lack of kind of written materials. Personally, I'm looking forward to the discussion, even if it just gives a kind of reality check flavor of what to expect when we receive those formal proposals.
Yep. I guess the other question.
It creates a platform or a space for potentially some as you were saying, Commissioner Jordan, like cross-departmental conversations, sharing, which might not occur unless you create the space for that to occur. So, I mean, I think it could have value as long as everyone comes to the table willing to kind of share what they've been working through, because it could be challenging for people to share that they may be eliminating positions. So I don't know if I think maybe the theme should be around, how could we work together across departments to find ways to share positions, to share costs. I don't know. That's just one theme maybe for the meeting could be around that.
But it's also good, I think this was something we discussed, this is sort of the, one last meeting prior to when the numbers are due to be submitted. So it's an opportunity to touch base with the board before that happens.
Well, I think reinforcing from the board, the budget letters that were sent out, the target budget concept, we are expecting departments and electeds to meet these target budgets. So I think that could be helpful. The other question I have is, do you want this currently we have a strategic planning meeting that morning, 9 to noon. Do you want to use that time slot, that window for this meeting, or do you want to schedule another one? I don't think we're gonna have a lot of budget conversations for you by that time yet. But we could use that morning. So is there a preference for the commissioners? Oh, actually, no, I'm wrong. I forgot this. We do have one topic at least with the sheriff's department. They're doing their mid-year review with the board at that time, probably till about 10:30. So we could always do the 11 to noon or 10:30 to noon over at the Public Works building.
Let's do that. We'll start with the sheriff's office in here, and then we'll walk over to the other building and.
Yeah. It's like four or five blocks. It's pretty close. All right. Thank you for both those.
Okay. Any other miscellaneous items? Well, if there are, Matt?
We have about an hour's worth of executive session items.
Dude? Really?
They're all, we really do. We have,
What do you mean?
Been-
We-
excuse me,
We've been warned.
I need at least 3 of you. all pending and potential litigation under RCW 4230-110. The first one, no action in all four of these. First one, I'd like Scott Simmons, Mike Sparber, Chief Hooper, and more. The second one, Scott Simmons, Scott Chesney, and Jordan Neal. Third one, Scott Simmons, Kyle Tuig, Jeff McMorris. And then the fourth one, Scott Simmons, Colin Charbonneau, Summer Rife, and Jeff McMorris.
Okay, so it is 11:31. 1 hour worth of executive session items as stated by Mr. Folsom. And at the conclusion of those executive sessions, we will be adjourning for the day. There will be no action while in executive session. So we will see everybody back tomorrow at 2 o'clock for our legislative action.